What is type 2 diabetes? Type 2 diabetes is a chronic condition that happens when you have persistently high blood sugar levels, known as hyperglycemia. Healthy blood sugar levels are 70 to 99 milligrams per deciliter. If you have undiagnosed type 2 diabetes, your levels are typically 126 milligrams per deciliter or higher. Type 2 diabetes happens because your pancreas doesn't make enough insulin, your body doesn't use insulin properly, or both. This is different from type 1 diabetes, which happens when an autoimmune attack on your pancreas results in a total lack of insulin production. With type 2, your pancreas makes some insulin, the hormone that helps your cells turn glucose from the food you eat into energy. In some people, your cells don't respond to this hormone as they should, a condition called insulin resistance. In type 1, your immune system attacks and destroys the cells in your pancreas that make insulin, leading to high blood sugar. Doctors aren't sure why this happens. Type 1 isn't related to weight or lifestyle habits. It used to be called insulin-dependent or childhood diabetes. How common is type 2 diabetes? Type 2 diabetes is very common. More than 37 million people in the United States have diabetes, which represents 10% of the US population, and about 90 to 95% of these people have type 2 diabetes. Researchers estimate that type 2 diabetes affects about 6.3% of the world's population. Type 2 diabetes most commonly affects adults over 45, but people younger than 45 can have it as well, including children. The symptoms of type 2 diabetes can be so mild that you don't notice them. Symptoms include being very thirsty, peeing a lot, blurry vision, tingling or numbness in your hands or feet, fatigue or feeling worn out, wounds that don't heal, yeast infections that keep coming back, feeling hungry, weight loss without trying, and getting infections. Risk factors for type 2 diabetes include family history such as having a close relative like a parent or sibling with type 2 diabetes. Age is another factor, being 45 or older. Weight is crucial too, being overweight or obese, or having a waist size above 35 inches for women or 40 inches for men. Physical activity matters as well, being physically active less than 3 times a week. Ethnicity plays a role, being of South Asian, Chinese, African Caribbean, or Black African origin. Having ever had gestational diabetes or given birth to a baby who weighed over 9 pounds is another risk factor. High blood pressure and having high triglyceride levels or low levels of LDL, or good cholesterol, are also significant. Sleep patterns, having unusual, disturbed, or reduced sleep, and taking certain medications like statins, which can slightly increase the chance of developing diabetes, are additional factors. Type 2 diabetes is a chronic condition that requires lifelong management. Treatments include lifestyle changes, medication, and insulin therapy. Lifestyle changes involve eating healthy meals, limiting calories, and exercising to help you reach your target blood sugar levels. Medication may be necessary, and your doctor might prescribe one or more of the following medications. Metformin, which reduces glucose production in the liver and improves insulin sensitivity. Sulfonylureas, which help the body produce more insulin but may increase the risk of hypoglycemia. Glitazones, which strengthen the effect of insulin produced by your body. Glinides, which increase insulin production. Gliptins, which stimulate insulin production. And gliflozins, which cause more sugar to leave the body in urine. Insulin is a synthetic hormone that directly lowers blood sugar levels. You can take insulin as an injection, inhale it, or use an insulin pump. Over time, you may need more than one medication to control your blood sugar levels. Special times, like during pregnancy or if you're hospitalized, may also require insulin. If you have any questions, please leave them in the comment section below.